Angina is a chest pain that usually occurs on exertion and is relieved on rest. The main cause of the angina is the myocardial ischemia, which can be of the two reasons. It can be due to the decreased blood supply to the myocardium or increased oxygen demand by the heart. Both of these can lead to the myocardial ischemia, which can result in the chest pain called angina. The ischemia can be caused by the several reasons. The main causes includes atherosclerosis. Atherosclerosis is the formation of the plaque in the artery. It can be coronary artery or any other, which can lead to the impeding in the blood flow to the heart. Also, there can be the inflammation of the aorta or the inflammation of the small blood vessels. There can be autoimmune disease which causes the destruction of the connective tissue. As we know that the blood vessels are made of the connective tissue, so this will hinder the blood supply. Increased thickness of the heart wall can lead to the ischemia. Coronary artery disease can also cause shortage of the blood supply, or syndrome X. Syndrome X is also called the microvascular angina. It is a cardiac myovascular dysfunction in which the patient have the angina but with normal coronary artery on the angiography. So this was the pathogenesis of the angina. Now we will learn about the risk factor. The risk factors of the angina are divided into the two. Some are the modifiable that we can change in our life, which are directly related to our life and the mode of living, and some others are the non-modifiable, which are not in our hands, so we can't change them. Modifiable correct Modifiable risk factors include obesity. Obesity is a mother disease, as we all know. So if we can control obesity, we can decrease the amount of the cholesterol or the other things which can hinder the blood flow. Increased amount of the low density lipids or the cholesterol is also the leading cause of the angina or other heart problems. Smoking, alcohol, stress, diabetes, or occupation. Occupation also affect the people, such as some jobs which include the stress can lead to the heart disease. Lack of physical activities. Those people who lack the physical activities, they also experience angina. Or the diet, if the person is taking diet which is high in the cholesterol, will have to face the angina. The non-modifiable risk factors include the age. It is directly proportional to the age. More age of the patient or the people, then the more risk of the angina. Sex. Angina is also related to the. According to the graphs, it is suggested that the occurrence of angina is more common in the women. Also, the family history also suggests that if your family have the history of the angina, then you will probably have also. Blood coagulation factor also cause increased risk of the angina, as they can cause the platelet deposition. Origin. The occurrence of the angina is also concerned with the country of the region. It is seen that the Asian peoples have more chances of getting angina. And lastly, the genetics also plays an important role in the occurrence of the angina. Other risk factors includes the diet, the lifestyle. If the person's lifestyle is sedentary and he do not do most of the work and just sit idle and take that diet which is high in the fats and the cholesterol, then he will probably have the chances of getting the angina. Personality, it includes the stress. If a patient is taking more stress, then he will get angina. If the patient's work is making him more stressful, then it will also cause the angina. Social deprivation is one of the common cause of diseases nowadays. End stage renal failure also cause angina. HIV, human immunodeficiency virus, or the AIDS can also increase the risk or make person susceptible to angina. And the history of medicinal radiation. Clinical features of the angina include chest pain, which lasts from 5 to 15 minutes, and this 5 to 15 minutes is the time up to which the myocardium can withstand ischemia, and after that the patient can go into the myocardial infarction. Substernal pressure can also be felt, and the chest pain can radiate to jaw, neck, and the shoulders or arms. Chest discomfort is also seen, the heaviness and the pressure on the chest, the squeezing or the tightness. You can see the patient making fist and holding it on the region of the heart or the chest. It is usually seen. The rarely the symptoms which occurs include the stabbing pain, sweating, shortness of breath, or the nausea, which are most commonly occurring in the myocardial infarction. The factors which can aggravate the angina includes the aggravating factors for the angina includes increased oxygen demand, exertion, stress, cocaine or the drugs, and methamphetamines, which is a type of the drug, or we can say recreational drugs, which is most commonly used by the students nowadays. And the angina is relieved by the rest or the nitroglycerin. Nitroglycerin is the one of the major drug which is used for non-episodic or non-recurrent angina.